Welcome back. Well, let's discuss one particular topic which is making headlines. Reports say that hospitals are introducing charges from disinfection fees to peak charges for operation theatre time, etc. So basically, the reports also indicate that insurers, once able to offer comprehensive packages and predictable costs, are now facing unbundling of services. So what is taking place, Hormaz, is that, there are charges which are being unbundled in hospitals. First, they used to be a part of the care or the room charges are now being separated out and, charged separately so that the cost of the bill goes up. To get more perspective on it and, how exactly surge pricing is taking place. For example, if you need the operation theatre at a certain time, then maybe there could be an additional charge for it, etc. To talk more about it, we have with us Ajai Kumar, Dr. Ajai Kumar, who's the Executive Chairman, Healthcare Global, on the line to discuss this. Dr. Kumar, thank you very much for taking the time out and speaking with us. We understand that you are traveling. This particular piece of news is really making headlines now because there is fear that hospitals are probably unbundling their charges. They're looking at surge pricing in some form or manner and separating a lot of their costs. Is that actually taking place? What's the on-ground situation?
Yeah, the on-ground situation is most of the patients are aware what are the charges are going to be when they enter the hospital. And I believe in complete transparency. I think the patient and care provider should be provided the actual charges. It may be for plus or minus 5% at the time of discharge. This should be audited by all the hospitals to make sure there is absolute transparency in the system. Yes, there are reports of hospitals doing this, and there are reports they are doing to cover some additional charges or HR charges and all. But whatever it is, I think in my view, what we do at HCG is it should be clearly stated to the patient. Before they agree for a procedure, it is of paramount importance that the patient know what are the actual charges be. Obviously, the patients have a choice. They can make the final choice. And also, I believe, in my view, while there is a lot of thing about who is running the hospital, the private equities and all of that, the doctor-patient relationship is important. As a doctor and a promoter, I can say one thing very boldly. The doctor's involvement in deciding what should be the charges, fees is also important. And that is why sometimes I believe doctor administrators are good because we take a lot of this into consideration. While in private equity, there is a theory that doctors should be medical ed, there should be separate CEO, but there is also a merit for saying, can a doctor be a CEO? Because I think we understand what is the procedure, what should be the charges, and why we are charging, if there is any extra. So in my view, ethics, transparency is important. And that is why I always say margins are important. When you look at margins, if somebody is having 20, low 20, yeah.
I just wanted to get an idea in terms of whether this is actually happening on the ground. This surge pricing that, for example, for example, an OP is charged at a premium time differently. And angioplasty, if in case somebody needs a stent, then it's an additional charge. Earlier, it used to be a package which, patient used to get. So is this happening on the ground? Because the larger hospitals that I spoke to said that it's not taking place.
It is not. Best of my knowledge, it is not happening routinely. It is not. There may be some hospital isolated incidences, but I can tell you one thing. Like Harvard report came, Harvard Business School, Indian customers are very smart. They see in between the lines. If there is anything like that, I'm sure they will detect. But I think, best of my knowledge, it is not happening. But I think we should also create public awareness. So if it is happening, they should bring it to light. Today, there is social media. There is so many things. It should be brought to light.
Dr. Ajai Kumar, good afternoon. Thank you so much for joining in. The question that I wanted to ask you is, in a place like India where the word hospital is generally associated with fear, would this, in general, if at all this is taking place on ground, which you have categorically said no, apart from one-off instances, would that act as a further deterrent and act as a bigger gulf now between the patient and the caregiver?
Yes, absolutely. Because with that, we will lose the trust. See, the most important factor for a patient to go into hospital or see the doctor is the trust. If we break the trust, definitely the relationship will change. And the patient will always wonder, if I order a scan, if I order something, is this doctor really ordering it? Is it necessary? So that trust factor is the most important thing. And sometimes because of this news, something like that, when we hear patients are being charged extra, their search, I think it does help to break the trust. But we should make sure the trust is not broken.
Okay. Just quickly, then, Dr. Kumar, obviously there's been so much talk about CVC and the 60% stake that they have in HCG and the fact that they want to exit. But, the news has died down in the past couple of weeks, couple of months. Is it on the back burner? Where do things stand? Is there
as I said in the past, I would like you to ask CVC. They will be the ones who are exiting. And I can say one thing, I am not exiting. So I am there for HCG and I am there. My issue is, excellence, medical quality. I'll continue to pursue that.
Okay. So as of now, you are not aware of what CVC is doing, but I mean, any timeline that you could probably leave us with in terms of maybe what they are thinking in terms of an exit?
I would say in the next 4 to 6 months, you may hear something. But the best person to answer is CVC.
Okay, all right. So we're going to leave it on that note. Thanks very much for joining in and speaking with us. So that's the word coming in from HCG that yes, maybe CVC could probably look to exit in the next 4 to 6 months. But obviously the last word remains with them. We'll take a short break. On the other side, Manisha Gupta will be with us to take us through the commodity space.